The new cases and the advice of these experts have led us to give new guidance to North Carolina residents and to declare a state of emergency for our state.
That was 29 months ago, a little more than 2 years, Governor Roy Cooper declaring a COVID state of emergency. As of less than just an hour ago, we are no longer under that emergency declaration. And while you might not notice a really big difference, Ben Thompson explains it's something that's helped the state get through the pandemic the last 2.5 years.
Some measures that protected you during the pandemic will finally come to an end. Let's connect the dots. Back in March 2020, Governor Roy Cooper declared a state of emergency over a new virus slowly spreading across the Carolinas. It provided some consumer protections, like banning price gouging during the pandemic. It also allowed truck drivers to work longer hours to help deliver critical medical supplies. Healthcare systems also benefited from the order with more staffing flexibility. Cooper kept extending the order for more than 2.5 years as the virus lingered. Now all those measures coming to an end. So why now? Cooper says the latest state budget gives hospitals and medical providers the tools they need to maintain staffing levels while providing COVID vaccines and tests, all without the emergency order. And that is connecting the dots.
So the order has expired, but I got to tell you, the threat has not. North Carolina is seeing substantial spread. So let's take a look at this map right here. The CDC shows 62 of North Carolina's 100 counties are in that orange, indicating high spread levels. And as it looks like this, the strain on local hospitals as well as new cases to determine where the community stands. Only 3 North Carolina counties are seeing low levels in that green color. So because of that, the state has removed its emergency declaration, but some counties are following suit, some are not. Guilford County announced its COVID state of emergency would end with Governor Cooper's. The city of Greensboro was under that state of emergency as well. On the other end, though, Winston-Salem leaders say they plan on continuing the city's state of emergency. Mayor Alan Joines made the announcement on Friday. He says he intends to keep it in place because it allows the city to take quick measures should it be necessary to protect the public health. Well, the nation's top health agency has relaxed its COVID guidelines as well. Among the CDC's updated guidelines, 6 feet of social distancing no longer recommended. People exposed to COVID no longer have to quarantine at home, but they should wear masks for 10 days and test for the virus on day 5. The guidelines around masking indoors, especially where community levels are high, remain the same.
We're in a different place now with boosters, with antivirals, with monoclonal antibodies. I mean, things are much different in how we can keep people out of the hospital. Vaccinated plus an infection, hybrid immunity is very strong. And I finally see that the CDC is recognizing that.
The CDC, though, still recommends you stay away from large indoor gatherings. Now, with high CDC community levels in Guilford County, health experts say variants are the driving force behind the new cases.
The reproductive rate has gone up dramatically over the past 3 to 4 weeks in Guilford County. And a lot of that is around, there's a new variant in town, and that variant is very transmissible. So again, just being careful about being in congregate settings or large settings around lots of people.
Health officials are urging folks to stay up to date with their vaccinations and to get tested if they have symptoms of COVID-19. But will your COVID vaccine protect you against super contagious variants? Casey Decker verifies.
A lot of places are still seeing high community spread of COVID-19. That's in part because the variant that's currently dominant, the BA.5 subvariant of Omicron, has shown to be more resistant to both vaccines and natural immunity. That prompted one Verify viewer to ask us, will there be a booster shot specifically targeted at the Omicron variant? Our sources to answer that question are the FDA, Pfizer, and Moderna. In June, the FDA advised vaccine makers to work on a new shot for the fall of 2022. This one, they said, should have 2 components, the original vaccine plus a new formulation specifically designed to protect against Omicron subvariants, all delivered as one booster dose. In the past 2 months, both Pfizer and Moderna announced they're working on such a shot and will be selling it to the U.S. government for distribution once it gets approved by the FDA. The FDA told Verify both company shots could be available as early as September 2022. So we can verify, yes, there will be a vaccine targeted specifically for the Omicron variant. So who will actually be able to get that booster? The simple answer is we don't know. Right now, the federal government has only authorized one booster for most Americans. People who are 50 or older or have weakened immune systems, they can get a second booster, but no one else. Now, the FDA says part of the reason it hasn't authorized second boosters for most folks yet is they wanted to wait for a shot that would be more effective against the new dominant strains. So once that shot becomes available, it's possible more people will become eligible. But the FDA wouldn't confirm that that's for sure the case, so we'll have to wait and see.
Well, the North Carolina Department of Health and Human Services was reporting that 67% of North Carolina's population has gotten at least one COVID shot. 63% have completed their vaccine series. The most vaccinated age group in our state, people 75 and older. NCDHHS is reporting 100% of them have gotten at least one dose. The most important thing health officials are urging you to do is to get that shot and to stay up to date on those boosters. While you may still get COVID, research shows having that vaccine will help you keep out of the hospital and helps prevent death. WFMY News 2 at 6 is coming up.